now it's a very exciting time because we have so many more possible options for people entering treatment. So we have the traditional component of going in and seeing an individual therapist and working with that therapist. That therapist may or may not have group therapy as part of what they do. And if they don't, sometimes they'll have somebody that they do know who leads a group. And so both the therapist-led group along with the 12-step group process, we're finding is at a basic level critical for recovering addicts to have that type of process. And then adding in a therapist who does couples work, so somebody that is trained and knowledgeable about interpersonal dynamics and what goes on in a relationship and can work with them as a couple. I think it's more ideal to have a separate therapist when there's the resources in terms of a therapeutic community, to have an individual therapist for each of the individuals, and then for them to work with a separate couples therapist. And that couples therapist may also do the family therapy as time goes on, or maybe you add another family therapist in. Certainly believe that more treatment people to address specific things is helpful as long as that treatment team is staying in communication with one another. So as a recovering addict seeking help, certainly finding people that are open to using other professionals in their community and who are prone to communicate with those professionals as well and don't try to do things just on their own. Because right now we have all kinds of resources in terms of individual treatment, and I don't think any one therapist does both the cognitive behavioral work of paying attention to the thoughts, the way we distort thoughts, paying attention to the behaviors and how do I turn my behavior in a more productive direction, but also a treating professional that would know some of the trauma treatment procedures that we now have, whether it's hypnosis, imagery, somatic experiencing. There are all kinds of options available. So finding a therapist or even two therapists to work with you individually who may have different skill sets and strengths is what I'm finding to be incredibly helpful and something in our group that's made all the difference in the world in regards to treating somebody. Because I certainly used to try to do everything myself, and now I've learned my limitations. and so I do what I do best, and then I depend on other people to do what they do best, and that kind of treatment team approach I'm finding is really helpful.
If the individual doesn't have much resources themselves, how would you prioritize those components?
I think it's critical in the beginning to work individually, to get your feet under you, to get an understanding of what's going on, to get your story out and understand your story, to begin some level of recovery. So if you can't do more than that, start there. And then what we found is bringing the spouse in and doing some work. So even if there is one therapist, to do that initial phase of treatment, then to bring the spouse in as soon as possible. That's certainly a debatable topic. Our preference is to do it earlier rather than later, and do the couples work. And then if there's again one therapist, you can even alternate. Maybe do one individual, one couples, or two individuals in a couple session. When resources are limited, you can mix it up and still have a productive outcome. From the individual therapy, then there's other steps as well. I'll go to the other extreme, which is a residential treatment program.
Okay.
And there are a number of those throughout the country that are doing very good work at this point in time. And that's for the individual who can't seem to manage on a day-to-day basis. They can't maintain their sobriety. There may be emotional things to where they're distraught, they can't function, unable to focus at work, or even focus on a day-to-day basis. In those situations, it's vital they get into a residential treatment center in order to again gain some stability, have a 24-hour care situation. Most people find that real shaming to go into a residential program. The reality is it's not. It is something, it's one of the most nurturing things you can do for yourself when you're at that point in life where you're not managing life. And so to enter into something where you can get that 24-hour care is immensely helpful.
It may give you a jump start on your recovery as well.
Yes.
So.
Because what they do extremely well in residential settings is to have groups. So they build community, so you're used to telling and get comfortable telling your story to other people. And there's a strong educational component, so you gain an understanding of what's gone on, what's led you to where you are, and then where you can go from there, because there is a tremendous amount of hope in recovery. Those that fully engage in the process and are committed to working things through, no matter how difficult or how long it takes, generally have a very good outcome for themselves. What I'm also enjoying about the point in time we are right now is there are in-between options between the typical outpatient therapy and the residential treatment. There are more and more intensive outpatient programs developing, and what's nice about that is that they even have different flavors. And so some of the intensive outpatient programs are done predominantly through group. There's others that focus just on healthy sexuality. And there's some that do a tremendous amount of individual treatment as part of their processing as well. So as a treatment provider, knowing your client and knowing what their personality type's like, knowing what their issues are and what might fit that particular client best. Would they do better in a group situation, in intensive outpatient therapy, to where that building community with others and really an individual and how to process emotions with people is going to be far more productive than predominantly an individual program is helpful. Is a couple at a time where they really need to be focused on their sexuality and creating a more healthy sexual relationship, or there's just so much dysfunction in their relationship they just need to process and get that pulled apart to where they can get a better understanding about where they are and where they need to go. It's an exciting time in that regard. And knowing that there are options, so wherever you are, if it's not that discombobulated state of needing residential, but boy, I need a lot more than I can get with 2 to maybe 4 hours a week, then there is a place that typically an individual can go. Staying with this process means that initially it's going to be disruptive and there's going to be all kinds of chaos, but you've been living with that already. So it's more of the same, but it's known and it's out on the table. Is very helpful, and then moving from that kind of understanding and normalizing of a process to, okay, now you're into the long, difficult work. You're in the day-to-day life of completely revamping how you think about things and how you do your life. What I so much encourage people to consider and think about is the worst pain you've had in this process and the worst judgment you made about yourself. You can have the exact opposite experience on the positive side of a kind of intimacy with self, kind of intimacy in relationships that I think few people actually accomplish. Wonderful thing about going through a recovery process with sexual addiction is you can have a rich, fulfilling life in a way that many people don't touch on during their lifetime experience.